So, are you planning for a total knee replacement surgery? It's very normal to feel anxious about the procedure because you don't know anything what is going to happen inside the OR. So, in this video, I'm going to explain you in detail in a very lucid and understandable language what is actually done in a total knee replacement surgery from your admission to your discharge. Namaskar. I am Dr. Prasun Sanyal, consultant orthoplastic surgeon. So before going for the total knee replacement surgery, you should know what is actually done in the procedure. So usually patients get admitted one day prior to the day of surgery. Usually surgeries are kept in the early morning. Before the day of the surgery, the patient are instructed to take certain medications, and on the day of the surgery, in the early morning, they are instructed to have a wash with a afterward solution to decrease the bacterial counts over the body. So before contemplating for the total knee replacement surgery, you will be evaluated for a pre-anesthetic clearance. This will include many blood tests and x-rays, echos, etc. You need to inform your doctor regarding your coexisting health conditions, especially diabetes, hypertension, any heart diseases, or any blood thinners you are taking, or any other rheumatoid medications which needs to be stopped a certain days before the surgery. The anesthesia which is usually done in most of the total knee replacement cases, it is usually the spinal anesthesia or a combined spinal or epidural anesthesia, where needle is introduced in your back to push the anesthetic medications. You will remain conscious, but you will not feel any pain. Most of the cases, the total knee replacements are done under tourniquet to minimize the blood loss. So after being taken in the OR, the anesthesiologist will induce you. Most of the cases, it will be a spinal or epidural anesthesia. In very few cases, rarely, if the spine is very stiff or if any somehow the spinal anesthesia can deteriorate your health conditions, then there might be a need of general anesthesia. So in the spinal anesthesia, you will retain your consciousness, you will understand what will happening, but you will not feel any pain. So after the anesthesia induction is done, then the actual surgical procedure will be carried out. In the total knee replacement, what we essentially do, we resect the damaged or diseased cartilage along with the eroded bone from both the femur and the tibia, and we replace it with the implants. And the implants are usually fixed with the bone with a medical bone cement, which is usually most of the cases the Palacos bone cement, which is a gold standard for all knee replacements. Normally, the duration of the surgery is around 1 hour to 1.5 hours, but for all the other procedures included, the patient will stay in the OR for around 3 and 3.5 hours for a single total knee replacement surgery. So after the surgery, you will be shifted to the recovery room where you will be evaluated by the anesthesiologist about your present parameters, and you will be shifted to your bed within 1 to 2 hours after the surgery. Usually, we make the patient stand on the next day after the surgery because the effect of the spinal anesthesia has to wean off. So from day 1 after the surgery, we ambulate the patient. On day 2, we change the dressing and do the post-operative x-ray. Usually, on the day 2, the physiotherapist conduct the patient to ambulate or walk with walker, and day 3, they usually start with a climbing stairs or commode training. Patients are usually comfortable to go home on day 3 or day 4, depending upon their recovery. So in the post-discharge phase, the patient should be very much cautious to take their medications as prescribed for the duration. After the discharge, you need to perform a physiotherapy regularly and with strong motivation under a trained physiotherapist. This physiotherapy will improve your power of your muscles. It will strengthen your muscles to improve the recovery process. Always look for the dressing. If there is any sign of redness, swelling, pain, always inform the concerned surgeon. Don't take any antibiotics by your own. Don't sit in a low chair or low commode in the initial days of your surgery. So remember, the total knee replacement surgery, it is not just about the surgery alone. It is a combined effort which is put in by the surgeon, the anesthesiologist, the physiotherapist, and most importantly, the patient. A motivated patient will achieve a greater functional recovery in within 6 to 8 weeks, and he or she can appreciate it within 6 to 8 weeks in improvement of pain, swelling, stiffness. And with each passing months with regular physiotherapy at home without physiotherapist and with regular exercises, you will feel more confident and pain-free with your daily activities. So, if you are planning for total knee replacement surgery, you need to keep in mind all the facets to smoothen your recovery, especially after care of the surgery, which includes regular physiotherapy. It will enable you to have a pain-free, stiffness-free life for the rest of your life. Stay tuned for further updates and informations pertaining to the knee replacement surgery.